The debate over whether vaccine mandates should apply to air travel is only intensifying as cases continue to soar. My next guest saw this coming months ago and wrote about it in the Washington Post. Here was his take. Quote, Biden's vaccine mandates are not enough. He must also mandate vaccines for travel. Dr. Zeke Emanuel, former member of then President-elect Biden's COVID advisory board, joins me again now. Dr. Emanuel, before we get to the airline situation, I give credit to Dr. Fauci for coming on and talking about the confusing nature of this recent CDC guidance. I don't know that we shed any new light on the situation, but react, if you will, to those issues before we talk about airline travel.
Well, I've been very, not so much confused, but perplexed by why the CDC did that. It doesn't seem to be medically indicated. The fact that people shouldn't test after 5 days before they take themselves out of isolation seems very perplexing. Now, maybe they shouldn't get a rapid test, but should get a PCR, but we don't have availability of PCR. That certainly has to be a component of it. And then this issue of wearing a mask, where the CDC did not specify high quality masks like N95s or KN95s, I think was also problematic. And if you're really asking people who are, are you symptomatic? Are you asymptomatic? This isn't exactly very clearly specified for people. There's a lot of judgment by people as to what qualifies. And so I think on the whole, it actually isn't helping. And there is, I think, for many of us, a great deal of suspicion that, as you put it, I think it was economic reasons. It's not the health of people. It's the other considerations. Can we keep the hospitals functioning? Can we keep the airlines functioning? And things like that really weighed heavily in this determination.
Back in September in the Washington Post, as I pointed out, you advocated for there to be a travel mandate. Are you surprised that step has still not been taken? And did Dr. Fauci, in responding to that issue, say anything that caught your ear?
I am surprised. I think it's a mistake. We obviously thought many months ago that we should put it in place, and we argued for it in September because we anticipated that people would need 2 vaccines, and if you wanted to prevent transmission during Thanksgiving, that was going to be an important element, especially because it's not just on the airplanes, it's in the airports, it's in the transportation to and from the airports that you have potential for transmission. It suggests to me that Tony Fauci is interested in having the mandate. I think that's what his original comment suggested, but that there are other people in the White House above him, I guess, who are not interested in and not supportive of that. I don't know what the calculation is, and I don't know why we want it on international travel but not domestic travel. That doesn't really make sense to me. There is a logistical issue of how people prove that they're vaccinated, the fact that we have not put in a good vaccine certification system. So that is part of it, I'm sure.
I should point out that you extend that to interstate travel, including buses and railways as well, not just airline travel.
Yeah, if you go on to trains and you take an Amtrak train, you can see that, there's chances for plenty of, those are big cars, people are in them. Even if the air is circulated multiple times in an hour, people aren't, I would say, assiduous in their mask wearing. They're eating on these trains. That is another place where we could have transmission, especially with something that's highly contagious.
Do you think that it's out of concern for private industry? In view of Dr. Fauci's comment, and economic was not a word that he used. I used that, and perhaps that was not a good paraphrasing. But in view of what he did say, do you think that there's concern that the airline industry has already been rattled and that probably they would suffer if, in fact, a mandate were now to be put in place?
I don't actually think they would suffer. I think that it's possible that a lot of people would feel safer. I think what people are suffering from is the fact that there's a very highly transmissible variant out there, and you see people pulling back, canceling airplane trips, canceling hotel reservations, not going to the theater, etc. If people were more confident that transmission was low, you would probably see a lot more of that. And the way to get that kind of community level transmission to be low is to have more people vaccinated. The reason to do the vaccines for travel is to get more people vaccinated. That is the fundamental point.
Dr. Emanuel, from social media, put it up on the screen and I'll read it aloud so that both Zeke Emanuel and I can respond. What do we have? We don't have a choice who we are stuffed into a cabin with, says Julie. You obviously agree with that point.
Yep. I agree with that point, and I think the same thing is true when you go to a restaurant, when you go to the theater, when you go outdoor, when you go into some facility. You don't choose who they are. You don't know how good the ventilation is, although on airplanes it is good. And you know, a lot of people are not, as I said, not good about wearing high quality masks and keeping them over their nose and well sealed.
Look, it can be done. I've noted before, the first time, this will sound odd, the first time I was ever asked to show proof of vaccination was at a Dead and Company concert that I went to several months ago. Now, was it the most, was it the most arduous of inspections? Not really, but I appreciated it, and 40,000 people were there that night. One more, if I can read it aloud for Dr. Emanuel. Put it back on the screen if you can. Here we go. Ideally, yes, but perceived loss of liberties. Yeah, that's a good argument. What do you say, Dr. Emanuel, to those who say, don't tread on me, this is an intrusion on my personal liberties?
Look, I think this argument, I think I said it before, this argument is not an argument that any American founding father would understand. They would be confused. You mean you're going to go around with something contagious, something that could kill other people, and you say that you have the liberty to do that? They wouldn't recognize that. It's not a matter of liberty. Liberty is when you don't impinge and you don't threaten the well-being of your neighbor. When you threaten the well-being of your neighbor because you're not vaccinated, you aren't taking precautions, that's not liberty. That's not taking individual responsibility. And I think that is the fundamental issue. When you have an infectious disease circulating and you could be spreading it, you are not at liberty to infect other people and potentially end their lives. That's not what we stand for in this country.
Dr. Emanuel, thank you so much as always. We appreciate it.